a 3-year-old girl, okay, a 3-year-old girl is there with a history of hydrocephalus, complains of severe headache and fever. The girl underwent a revision of the ventriculoperitoneal shunt 1 month ago, and the neurologist suspects that an infection has occurred during this particular revision. Okay. Which of the following organisms would most likely to be isolated from the shunt tubing? Is it Bacteroid physalis? Is it Condibacterian diphtheria? Is it E. coli? Or is it Staphylococcus epidermidis? Okay. So tell what you think is the answer of this. Is it Bacteroid physalis? Is it Condibacterian diphtheria? Is it E. coli? Or is it Staphylococcus epidermidis? In this particular shunt tubing, which infection most likely happened as per you? Please tell. Yes, RG, Shrisham, anything which you want to tell regarding it? Tell? No? No? Answer to this particular one is fourth. That is Staphylococcus epidermidis. Staphylococcal epidermidis. And why this is the answer? Whenever we talk about any particular intervention, I already told them, whenever the intervention is being talked about in the question, you should think for staphylococcal, this particular species, epidermidis. Okay, Abhishek have told rightly, fourth one, very right. And this is what is Staphylococcus epidermidis. And can you tell me this Staphylococcus epidermidis is what actually, guys? This one is what? This is a cons. Okay, what it is? It's a cons. And what is cons? Cons is coagulase negative staph. What is cons? Coagulase negative staph. And the intervention is this, that they have revised this particular shunt, and thereby in that revision, some infection is being put by the surroundings or by the person who have done that. So this is what is termed as intervention. So anywhere what you observe, IV cannulation, okay, catheterization, any sort of these particular things, if you observe up, you should think for which one? You should think for Staphylococcus epidermidis. Okay. Then regarding these particular ones, the other ones, Bacteroides physalis. Okay. Whosoever talks about the Bacteroides physalis, remember the Bacteroides physalis is a gram-negative bacteria. It's a gram-negative bacteria. This is a obligate anaerobe. It is an obligate anaerobe. And it is one of the normal commensals of our gut. Okay, normal commensal of our gut. And the question comes regarding it is that it produces lipopolysaccharide, and that particular lipopolysaccharide may leads to what? Shock and DIC. May leads to, not always. This question comes because the endotoxin of this is mild potent, not very potent, mild potent it is, and that's why we say it may leads to shock and DIC. Is it fine? Another question which likely to come regarding epidermidis is what, guys? The Staphylococcus epidermidis, this particular one associates with what? Early prosthetic valve. Early prosthetic valve endocarditis. Okay, early prosthetic valve endocarditis means somebody's valves are damaged and the surgeon have changed them, and within 1 year those also being damaged. So that is termed as early prosthetic valve endocarditis, and that is done by this particular cons, Staphylococcus epidermidis. And what is cons? Coagulase negative staph. Okay, what is cons? Coagulase negative staph. Fine.